welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're talking about coronary artery disease or CAD. To understand CAD, we first need to look at the arteries that supply the heart. These are called coronary arteries. The heart is a muscle, and like any muscle, it needs its own blood supply to function. That blood is delivered through those coronary arteries. So, what happens when they begin to narrow? That's exactly what coronary artery disease is about. CAD is a type of heart disease that affects the main blood vessels supplying the heart. It develops when fats, cholesterol, and other substances build up inside the arteries, causing them to harden and narrow, a process called atherosclerosis. Over time, this reduces blood flow to the heart muscle, and that leads to CAD. Coronary artery disease typically develops gradually over the years, and symptoms usually appear as a result of that reduced blood flow. So, what does that actually feel like? The most common symptom is chest pain, also known as angina. It often feels like a squeeze and a pressure like sensation in the chest, and it happens because the heart isn't getting enough oxygen to meet its demand. Other symptoms include shortness of breath, fatigue, because when the heart can't pump enough blood to the rest of the body, tiredness sets in, as well as nausea and dizziness. Now, let's talk about who's most at risk. Some risk factors are non modifiable, meaning we can't change them. These include age, family history, and gender. Men are generally at higher risk than women. Other risk factors can be modifiable, like smoking, which damages the walls of the arteries, and we have other risk factors as disease processes, such as hypertension, which contributes to atherosclerosis, high levels of cholesterol, and diabetes, which affect cardiovascular health. Now, let's look at what can happen if coronary artery disease goes unmanaged. The narrowing caused by atherosclerosis can progress to a heart attack, also known as myocardial infarction, which can then lead to cardiac arrest or even heart failure. Arrhythmias, that is, irregular heart rhythms, are also a complication of CAD. If you've watched my previous videos on congestive heart failure and myocardial infarction, you've already heard CAD come up as a major contributing factor in both of these conditions. Be sure to check those out for a deeper dive. From a nursing standpoint, care involves monitoring vital signs closely and performing a focused physical assessment, including heart auscultation and checking peripheral perfusion. Nurses also administer prescribed medications such as nitroglycerin that can help to relax the blood vessels to improve blood flow. Other medications may help by reducing lipid levels in the blood and managing diabetes as part of the treatment plan. And most importantly, patient education around lifestyle changes is important in supporting them for long term cardiovascular health. So I'll leave you with a question. What one small change could you make today for your long term heart health? Thank you for watching. If you found this helpful, please leave a like and subscribe. Also, let me know what topics you would like to learn about. Thank you and see you in the next one.